access response team in DuPage County. We are the team that works to make sure that our entire community has optimal health and well-being, with no one disadvantaged by race, ethnicity, or other identity. It's really good to see you all. We saw you all face to face, many of you, a month ago, and that was a great thing. We're going to be back together face to face in January. We're anticipating that. So we'll do this group as an alternating kind of a thing. We'll meet in Zoom 2 out of 3 times a quarter, and we'll do a face to face once a quarter. This morning, so I want to give a heads up to anyone who's on the call today, in this meeting today for the first time. We're going to ask you to introduce yourselves in a couple of minutes. Tell us who you are and who your affiliation is with, and what it is that brings you to this table, why this is important to you. In the meantime, I want to note that this is a live streamed meeting that's being recorded. So this is going to get posted on the website of the DuPage County Health Department so that the public can tune in to our deliberations and our data analysis and our strategizing. We have an ambitious agenda today. It kind of boils down to this. We're going to get to know the capacities of some of our members better so that we can be better at our collaboration. And we're especially pleased that Derek Cabrera from the American Heart Association will share with us. And we'll hear from Jan Geider a little bit, but Jan might give us some today and some in January. We'll figure that out as we go along. We're also going to look at how we build our long-term sustainability as a coalition. And Becky McFarland is going to share with us some opportunities around grants. We're also going to revisit where we're at and where we're going in the development of strategy as in our mission. And Kara Murphy is going to give us an update and some things to take action on later in the meeting. So as we get started, let me first invite anyone who has not been with us before. Please introduce yourself and help us get to know you better.
Hey everybody, my name is Molly Beckdean and I serve as the new director of We Go Together for Kids, which is a collaboration of about 50 organizations who serve children 0 to 18 and their families in West Chicago. And so I am thrilled to be here and to listen and learn and see how, physical and emotional wellness is a big part of what we do. And so I am just interested to hear and learn more about what you all are doing. So thanks for the invitation.
Thanks, Molly. It's very good to have you here. I'm so glad that you took the time to be here. Anyone else who is with us today for the first time?
Hi, Derek Cabrera, Community Advocacy Director for the American Heart Association. Very proud to be here and very excited.
Thanks, Derek. It's great to have you here, and thank you for contributing to our agenda and community building today. Is there anyone else who is a first-timer who would like to introduce themselves? All right, if not, then I'm going to go right back to you, Derek, and say welcome from the American Heart Association. Help us understand your strategy and how we can work together.
Absolutely appreciate it. Thank you very much. Just to kind of give everybody a little information about myself. I've just recently become the Community Advocacy Director here at the American Heart Association. I'm responsible for policies in City of Chicago, Cook County, and the Collier counties. As I've come aboard, we have come to realize that as much focus as the City of Chicago and Cook County need, our Collier counties also need us as much help and support as well. So it's my mission right now to make sure that I'm here to support everybody and the needs that they have, and making sure that things get access to care gets increased in DuPage, and also that any support and anything that we can do as a national organization, we're here to let you know that we're here to support you and give you that access as well. Our main focus right now has just been health equity policy. Right now, many communities, and as somebody had mentioned earlier in the conversation, has focused on racism as a public health crisis. And a lot of the public health departments, cities, counties have given verbal commitments to reduce health inequities. But the steps to reduce the health inequities are not as simple as just a resolution or a declaration, right? Everything has to be community driven. So a health equity action plan is something that can engage the community, prioritizing the positive change that everyone needs to live in their healthier lives. One of the things that we want to be able to focus on is eliminating health disparities, right? Achieving health equity and attaining health literacy to ensure populations so that they can live longer. I'll be posting a link in the chat to a health department study for 2030, which basically kind of encompasses the same idea, which is improving healthier lives. The biggest impact has been on strokes and people with cardiovascular issues. Those are the ones that have just gone down. It has not improved. It's only gotten worse. Dane, I know one of my coworkers was here last time and discussing about some of the ideas we have with giving people more access to bystander CPR. Right now, we even have just created a literacy on Spanish language, both video and written, to go ahead and be able to also give that information out. It's a population that's been underserved, but more importantly, it's a population that actually we found out wants to learn CPR, but just have not gotten that education. So those are the little things and stuff that we do in the research that we do. Being the American Heart Association, everything that we do is always scientifically driven. What we want to be able to do and work in conjunction with US stakeholders is to be able to create that action plan. And again, it's, unfortunately, sometimes funding and ideas when it comes to health equity during COVID was high, and we see it kind of like it's starting to not be as important. We've noticed funding in different areas and different counties across the country, where now that funding is starting to be lower and lower now than before. Unfortunately, as we all probably know, we're not exactly out of it yet. But at the end of the day, whether we're in it or whether we're out of it, health equity is important either way. In order for us to live in society and increase our ability to go ahead and live longer, we need to be able to create that. And creating it in writing, meaning a legislature actually go ahead and say, yes, we as, say, DuPage County want to go ahead and focus on that. And a health equity plan is nothing other than short than what you guys are already doing. As I've told Mila many, many times, you guys as a county are doing all the work. It's just now a matter of just putting it in black and white. God forbid anybody changes administration and leaves, and maybe that goal just might not be theirs anymore. But if you have it in writing and you have it in black and white, you have a goal set for either 2, 3, 5 years to gather information like you're doing with the MENA population, to be able to have an end goal of increasing, literacy in certain populations. And then more importantly, be able to then, based on that information, create funding opportunities for those programs is what our goal is. We've noticed that in some areas of the country where some districts are able to go ahead and adopt this type of policy, when it comes to federal funding, sometimes they look at it more adaptedly because they're like, oh, well, not only are they speaking the language, but they're also putting it in writing and committing to it as well. So, and that's our main goal, why we're here to be able to just try to get the support, try to get maybe possibly a working group together so we could all work together. You guys work in the communities that we want to be able to help in, so only you guys can let us know what the real needs are, and to be able to really voice, what the needs of the community. We're just here, as a national body, to be able to go ahead and give those resources, provide those things, and then for me, on a day-to-day level, be able to talk to any legislative officials that need to be spoken to let them know and relay that these are the goals of the group.
Derek, thank you very much. So I got a whole bunch of follow-ups, but I know through the chat that you've already spurred some interest in resource sharing. And Julieta, you mentioned the interest in CPR. Would you talk some more about that?
Yeah, my colleagues and I have been talking for some time this year, and just haven't gotten around to knowing where to acquire this training. But we're always out and about in the community. We're always out with the vaccine clinics, the food pantries. We're just thinking of the day something's going to happen, And we know that the first few seconds, by the time 911, responds and gets there, it's crucial many times that we are able to help someone. That's the difference between dying and staying alive. It is. So it's something, and if it's in Spanish, it's awesome because we need it. I know we have had this talk before, and it is important. I wish we could get that in our group. So
Well,
Julieta, this is Kara. I'm
Yeah.
sorry, Derek, I'll let you go
Yeah.
first.
no, I just want to say I dropped my email in the chat as well. So please feel free to go ahead and email me that. And then Dane Alexander, who's the one who works with organizations one-on-one as well, is on the line, and she'll be able to reach out to you as well. Go ahead, Kara.
Okay. Thank you.
No, you solved the problem. There's no need. If for whatever reason that didn't work out, let me know and I'd be happy to reach out to the health systems who regularly offer that training and see if we could provide it to the community as well. But Derek's a
Thank
great
you.
option. Thank you, Derek.
Thank you.
Hi, Derek. This is Tyrone Johnson with the DuPage County NAACP. I think it's a great opportunity to have these types of resources, not only for the community, but also for us as individuals as well. Our team is working on putting that CPR component in our CHW work so that all of our CHWs are CPR certified as an additional component. So I commend you on that and thank you for joining our group.
Thank you. And actually, Dane is actually working with the nonprofit where we focus on a train the trainer. And so with her group, with working at the food depository, they're going to be training close to, I believe it's 5,000 people a year, which is going to make a huge difference. So Dane, you want to speak a little bit on that?
Sure. Good morning, everyone. Like
morning.
Derek said, I am Dane Alexander, and I am the Community Impact Director for the Collier County, so Kane, DuPage, Will, and then Northwest Indiana. So I am the person that helps implement. So where Derek is on the policy side, I am the person that will help you put the policy into place at your place of employment or your nonprofit. I'm also that person that will help you even get started to figure out where to begin with the whole, if you want to do hands-only CPR or bystander CPR, or if you want to do something with like a screen and refer. So, excuse me, I put my information in the chat. You can reach out to me anytime. I'm here to talk to all of you about how we can just, work together as a community to help with these health disparities.
Derek, good morning. And hi, Dane, how are you? Seemed like I just saw you not so long ago. Derek, talk to us, please, about sudden cardiac death and particularly how it's affecting Black men, and how are you adjusting for social determinants of health when this is a phenomenon that does not necessarily target those at a lower SES, socioeconomic standard?
So the answer is we as an organization are not. Our goal again is to provide the resources to other organizations. So currently we're working with the YWCA. We just recently did a STEM for Women event where we tried teaching them that as well. And we focused on schools that were in underserved communities. But our job, and unfortunately, I'm not a scientist. I'm more of a policy guy. So, but those issues and that information, I have experts to be able to bring it, to be able to go ahead and answer those questions, provide maybe a webinar for your group, and other various things as well.
Thanks, Jan and Derek. Other thoughts, responses?
Good morning, everyone. My name is Tamika. I'm with DuPage County in AACP Health Committee. We just had a CPR educator come out, and they do CPR and first aid. And in the African American community, hypertension is very high, strokes are high, even within our own families and the organization. We've had some heart attacks and stroke in the last year. And so being able to jump into action and having these simple skills, but they're very important and vital to our community. We, as Tyrone mentioned, we are focused on making sure that we're certified. As a fitness instructor, I have to have certification in CPR every 2 years. But we want to do that sooner than that, because if we don't use it, sometimes we lose those skills. And so being able to jump into action in life-threatening situations is what we're doing. We're working with an organization called Life Safety 365. They're going to provide the training for our members at the branch and also for our health committee team. And we also have someone from the Ascension Mercy Hospital coming out and talking to us. They are considered the stroke educator. So what they're going to teach us, I don't know, but you know, signs of what to look out for strokes and things like that. And I'm wondering if the organization who was just speaking, if they have any information on maybe like a stroke coordinator coming out and educating our community on what to look for and things like that.
If not, that's something that we could definitely provide you. And also, if you know any schools that are missing AED equipment and also need CPR training for the schools, we actually have free access for that as well through other organizations that we work with. So, and again, providing health equity policy is something that's going to be important in affecting all those things, right? It's going to be in that policy, we as a group will decide, or should I say more like you as a group will decide, and say, we want to make sure that there's funding available for these type of groups. We want to make sure that so many people in the community get trained on CPR. We want to make sure that, you know, maybe there's a hotline that someone can call in order to be able to go ahead and call and find out where there's training for this. We as the American Heart Association has gotten it down to a 2-minute video on YouTube to be able to train, because in the past people did like, oh, I don't want to go sit in a class for, you know, an hour and, you know, do this and that. I mean, it really takes 2 minutes to be able to learn adequately to be able to go ahead and help save someone's lives.
Wow.
And, you know, the data shows that within those first couple of minutes, you're able to go ahead and CPR, your life changes drastically from being a higher at-risk person to being more minimum, and, you know, your ability to be able to live longer will improve as well.
And Derek, just real quick, you said that was called a bystander CPR. That's what you called it?
Correct.
Okay, great. Thank you so much.
And actually, before the group is done, I'll get the link and I'll drop it in there as well.
I just want to bookmark that in my own mind, Derek. You just let us know that there's a 2-minute video that we could share that it could equip anyone who's able to absorb that and has the capacity to take action. That's wonderful.
I wonder if there's a way that we could package that and promote it on our own social media to be able to get the word out in a more broad and significant way. Encourage people to participate and listen.
I'm going to switch gears a second, Derek, and move to your sweet spot, which is policy. So here we are as a coalition working on building our strategy and sustainability for the future. And we've assembled a wonderful team that's helping us with that planning. Policy has not been a strong focus. We need you there. I think we need to find a way to bring you into that conversation and make sure that we're looking upstream with you at where our strategy is going.
And that's my purpose for being here, right? I mean, you guys are a group of individual organizations whose main focus is on health and people's lives. My main focus is on policy, so you could definitely use me to be that person for you and have the discussions that maybe you as organizations and nonprofits aren't able to have because of you being that type of organization. So, you know, that's what I'm here for.
Derek, as you've been doing this work and looked around the region, any thoughts initial thoughts you have for DuPage as we think about policy focus? Are there things that you're looking at here that say, hey, this is an area you should be taking a look?
Obviously, being the American Heart Association, we're always anti-tobacco. So of course, vaping and menthol and flavored tobaccos is always a big interest for ours. We're actually dealing with the situation with the vape license that the city of Chicago is trying to push separate from a tobacco license. And it's a unique way of looking into things, but then, money's not being put into cessation or any marketing against, that type of thing. So those are the things that we would love to see focused on. But as I mentioned before to both Kara and Mila, again, you, DuPage, are doing a great job in and as it is. It's just now a matter of just, putting the work that you're doing and telling, your legislatures, hey, look, we want it in black and white. So no matter who's in office, we know that this is a focus, not only of us as organizations, right, but also as, as a government entity, because it is a vital importance that health equity, access to care, which includes nutrition, which includes literacy, all those things, are important, but they waver depending on what the focus on of that government entity is at that time. And we need to make sure, at least for a certain period of time, that that's going to always be the focus.
A few comments, if I could, because it's timely, and thank you, Derek, so much for the work that you guys are doing. I had occasion this week to look at the impact DuPage data, both on adults who use cigarettes and individuals under age 18 who vape. And if you haven't looked at that data recently, it is shocking, the number of individuals under age 18 who have vaped in the last 12 months. Those numbers really took me by surprise. But the other thing was that Karen Ayala was approached yesterday and therefore reached out to me, and this is why I share it in case anyone has any recommendations, by another partner who had some resources and funding to support smoking cessation and was particularly interested in interfacing with behavioral health partners and dental partners, looking for pathways to be able to provide this education and these resources to them. So if anyone has recommendations about behavioral health partners or dental partners who might be amenable to being contacted, I can help to make those connections, or certainly Karen can as well. Thank you.
And thank everybody for allowing me the time to go ahead and speak to you. And I look forward to working with everyone really soon.
Thanks, Derek. Thanks so much. Is there anyone else who had questions, comments, feedback?
Yes, David and everybody, good morning. This is Saima.
Good morning, Saima. Good morning.
Yes, thank you, Derek, for this presentation. As most of you know, that we work with refugees and other diverse community members. And we have a food pantry here and one in Rogers Park. Many community members, when they come, they don't find healthy options for the food. And it is hard because we have either canned items or, very, very few vegetables and fruits, and there is no meat, no fish, eggs or milk available easily. So I'm wondering if you know any resource who can help provide number one, education on eating healthy in different languages like Arabic, Farsi, Persian, or any other language. And if there are any other resources, we can provide them with healthy food through our food pantries.
Okay.
Simon, thank you. And although I think you were sending that up to Derek and Derek, I certainly want your response, but that's also probably a good question for the entire group to think about. How are we making sure that you're linked in to where those resources are available?
I'm sorry, I was having trouble unmuting. We'll definitely go ahead and send that out. If you could just send me your information, and then we'll go ahead and send that out to her.
Thank you.
Sama, this is Janice. I'm going to also put you in touch with Blue Cross Blue Shield. They promote healthy eating, and they are not opposed to making donations of fresh produce. So I'm going to introduce you to someone from Blue Cross. I'm sorry. I'll email you.
Thank you, Jen.
And Amali, you've shared a resource here in the chat. Would you mind sharing that out loud?
Sure. If you're looking for, programming, Cindy Glavin, who is part of the UI extension, does some really good work. She does SNAP stuff, but then she also does programming, recipes, all of that, training around healthy eating and food choices. And she's really linked into food pantries. We just had a food access meeting yesterday, so it's sharp in my brain, but she's really clued in to the realities of food pantries. And so she might just be a good resource to connect with. I put her email in the chat.
Thank you. Thank you so much.
All right, very good. All right, thanks all. Is there anything else for Derek and the American Heart Association?
Dave, I just wanted to go back to the tobacco issue again. Derek, at the health department, we've worked for years and years with Illinois Department of Public Health on Quitline and, a number of different referral type strategies so that dentists and healthcare providers can make referrals to that Quitline and make use of that resource. But I'm wondering if you've worked with Illinois Department of Public Health to bring a little more depth to that. Like, how about having Spanish or other languages either on the phone side of the Quitline or even on the text part of that, or any other strategies to use that? Because I know they've done some things with vaping that sort of address that for youth, but even on the adult side, there's a lot more could be done with that Quitline.
Yeah, unfortunately, with the state, they try to focus more that, whatever resources they're not able to do, that the county try to provide, or the city, depending on, the area. And so that's why, health equity funding and stuff like that is important. And having this type of language in can help counties and cities be able to get more funding on the federal side of things to be able to provide more resources like this for connectors.
Because that kind of goes back to your policy of, putting equity into these different resources. And last I looked at that Quitline, it was very one-dimensional.
Yeah, and on the state level is something that we're still working on. Right now, though, paid leave is a huge focus for us. So we got to try to do one battle at a time.
Understandable. Thank you.
Mila, do I understand right? I'm absorbing this, that our issue on the Quitline is that it's available in English, but
I'll check and see. The last I looked, it was not available in Spanish, and they had started a texting feature, but I don't know that that's got any language depth to it. And even maybe the strategies around it don't have equity built into, how they're promoted. We've done some different things on promotion, but same goes with the referral concept that Kara was talking about. You really need to get very specific about the referral to the Quitline so people even know about it. And if they get that referral from a trusted healthcare provider or a community health worker or someone in Immigrant Solidarity or ICNA Relief, they may be more apt to use something like that. Because I think otherwise it seems like maybe a government type program that they might not trust. And there are very few cessation resources out there. So really very few. So it's important to make good use of the ones we have.
Thank you. And so I'm seeing folks drop information in the chat about data that's available. Tamika and Becky. Tamika, yours is going specifically into Naperville. It sounds like you've gotten some good data there. Is there anything you wanted to share with the group about that?
Yes, so this is information posted on the Naperville 203 district website, but it was information that provides data on the issue of vaping and other aspects of student behavior at the schools. And I think it's very helpful. I asked for the data as a concerned parent. So it's definitely something that it's would be of interest. And I know that Derek mentioned that he was interested in getting into the school districts.
Thank you. And Tamika, is that data disaggregated? Are there race, origin, or language identities distinguished?
Definitely. Yes, it is very well broken down for someone like me to, you know, a low level of, you know, interpreting this data. And so it's very well, but I can share that information. I'll try to look for the link so that I can post it in the chat now, or I can share with you later, and you all can share with the group.
Very good,
Yeah,
very good.
can I, Dave, just quickly, I did put the countywide report that Tamika is mentioning. She has specific data for 203, but we, like, publicly available, we can see youth substance use rates for DuPage County overall. So that link is in the chat. But something I will say that we at the health department have been saying for years is that while that report is great and it's the best we have to understand teen health behaviors or health concerns, that although the survey collects race, ethnicity data, like demographic data in the beginning of the survey, it doesn't, and maybe the school specific report does this and I'm not remembering correctly, it doesn't say like of the students marking that they vape, like this is the race ethnicity breakdown. So you have the huge group overall and you know how many of those kids are different races, ethnicities, and then you have, and 7 of those kids vape, but you don't know which 7. And so something that actually prevention leadership team is doing is requesting some of that information from the group that does the survey. So as soon as we have that, they've given us sort of a fuzzy timeline on when that might occur. But as soon as we have that, we can for sure share that with the group or talk about that with the group to see if there's anything people want to pull out of there.
That would be great, Becky. That is a really good breakdown. And I was able to get more information because I spoke with the superintendent, the newest superintendent with the school district, and she was able to give me a better breakdown from just looking at, because it doesn't, you're right, it doesn't share a lot of that information that you would like to know, like if you're trying to break down as far as the race and ethnicity and breaking those different things down that you see in the data. So yes, I would be very interested in seeing that.
Tamika, as you might know, Rebecca and Derek, I live right between, almost equal distance between Naperville North and Naperville Central High Schools. There are 3 vaping stores in walking distance of my house. So what message are we sending, especially to our youth, if we're going to make it that accessible to them?
It's interesting you say that because part of the ordinance that the city of Chicago is passing is enforcing a distance between vape stores, fines, how many people they could serve, whether or not they could serve by a school, things of that sort. So those are all parts of policies that help with the health equity. And unfortunately, Naperville is not like Chicago, where it's separated by race, where one area may be predominant and say, look, we only want 1 vape shot and everyone's okay. Another area may want 3, 4, only because it's going to bring enough tax dollars to sustain the community. And those are all things we want to avoid. So yes, that's some of those are the little tiny policies that help in making sure that that's avoided.
Good. A good discussion. 9:08. I'm feeling a need to move us to the next item. However, as Jan, we're probably going to postpone your part of this to later. We could continue this discussion. Every time I've thought, oh, it's silent, let's move to the next, I hear another piece of feedback. So I want to make sure that we do cover this because this is really productive. Other thoughts or responses, reactions to Derek's presentation? Okay, so this is the transition point. I would like to leverage for a moment Dr. Asfar's comment about in our last discussion point about service to refugees and immigrants. And I want to use that to remind this group and let the newcomers know that it was about over a year ago that CIMA raised our consciousness and challenged us to identify the impact of COVID-19 on immigrants from the countries of the Middle East and North Africa. And as a team, we set out to put together a work group that would come up with some recommendations on how we could get that information so that we could take action in the community that would be effective for the entire community. We want a data collection system that brings optimal health and is a partnership between community data collectors and planners like us. So we did put together that work group. We did put together some recommendations. They got discussed here, but it was really clear that the first recommendation, solutions on hand, were not going to be adequate for our purposes in DuPage County based on the reactions that we heard around this table. So we have started digging deeper. We've put together a project to develop a recommendation for our community. And Tim Ackerman, a master's level public health student at Northern Illinois, is staffing us. And I'm so grateful to our partners here on HEART, especially ICNA Relief, for hosting sessions where we could collect survey data from persons who identify as coming from Middle East and North African countries. So grateful also, Kara, to you for reaching out to the health system to help us collect the ways in which the larger health providers today are actually collecting and categorizing. Now, we've made progress, but I want to let this group know today that we're going to be a little delayed in our ultimate product of recommendations and training. Tim has had to step away temporarily from the project. He's going to be back with us, I anticipate, in early January. So we're looking that we will probably bring this to its public presentation in about March. So I wanted to let you know that we're still moving forward. The goal and the vision are in sight, but we're a little bit delayed. And while we're here, I wanted, as we had a couple of minutes, I wanted to share another resource with you all that I think could be helpful. And I've just dropped into the chat a link to a Google Doc, and I want to tell you a little bit about this document. As Tim and I were involved in the project, Asma Jarrad of ICNA Relief approached me and said, Dave, I've just talked to a bunch of emergency food providers. I've raised their consciousness about understanding the needs of their Arab American constituents. And they said, what can we do about this? We are not collecting data in this regard. We don't know for sure how to track that. What is it that we can do? And Asma came to me and said, Dave, what have we learned as a coalition? And what would our recommendations be to this group? So I jotted those down in kind of global terms. These are not definitive actions to take, but they're lessons that we've learned and recommendations for providers of service who want to get better at understanding the needs of their Arab American neighbors. And there are really 4 lessons I put into that doc and 4 action steps that groups can take. And I'm going to walk you through those in a really high level here. You're welcome, if you want to look at that document at Google to follow up with me if you'd like, or in some other way follow up. But number 1, we learned in our journey that there are Arab American leaders in human services, healthcare, and advocacy who've been doing this work for years, and they love to help. We have advisors of the highest caliber who are cheering us on to succeed in this task. Number two, we've learned that they've created a range of solutions that they're trying out in their own communities and states and proposing at larger national levels as well. And we've got a list of those, and you'll find those in the appendix to the document I dropped in there. Third, we learned that there is a national coalition, a diverse, multiracial, multi-ethnic coalition that has come up with what they think is a good standard that states should use that includes Middle Eastern and North African. That's the standard we brought to this group to review, and we learned right away that it wasn't on its own merits enough to get our confidence. So we know we have to do more work, but it's out there and it's worthy of review. And then finally, we've learned that this idea of a category for Middle Eastern North African, MENA, is really pretty well understood and known among researchers and data-focused people, but less so in the community. And the implications of that are that as we think about including a category like this in our data collection, we want to be prepared that our constituents who identify as Arab American might say, what's a MENA? And there's work to be done at partnering with the community to determine what do community members think is the best way to bring identity that we can track so that we can develop solutions for optimal health. So those are the 4 lessons, and very quickly, the 4 steps that any organization could take would be, number 1, take a moment to take a breath and say, good job for making data collection a strategy for demonstrating your values of inclusion, fairness, and self-determination. If you're asking this question, you're on the right path. Thank you. Be our partners. Number 2, invite your organization leaders to read a brief paper. It's about 2 pages long, written by an expert, Nadia Abuelazam, about Arab Americans and COVID risk. Nadia reminds us why it's so important to do this. What's the risk if we aren't doing this disaggregation? What are the higher risks being faced by our neighbors as a result? Number 3, in your own organization, you can look at 3 kinds of solutions that have already been developed by a wonderful group in Dearborn, Michigan called Access. And the link to those 3 solutions is in the paper that I shared with you in the Google Doc. It's very, they take you on a range, very simple. Just add a MENA category. That's the lowest level. And then they work their way up to more detail. And then 4th, invite the Arab American leaders in your service area to a meeting to review your current data collection with clients and services as it exists today, and enroll their support in your organization's journey to figure out how do we want to collect this information in partnership with our community. So those are kind of guidelines that might help as we're on our pathway, as we've not yet got our firm recommendations and we've not yet got our firm training in place. These are steps that organizations could take. And Asma, I think you were with us. I don't know if you're still with us now.
Yes, I'm here, David.
Asma, I thank you so much for challenging me with that question. And I thank you so much for being a champion among the providers to say, how are you tracking and serving your neighbors? Exactly. And do you have any I wonder if you've got any feedback from those folks regarding their journeys?
They were very appreciative of this document that you put together. It's really helpful because it shows that there is, work being done, and it shows the steps. Like, that's why I asked you, because I know you were beginning on this journey, and so they are also beginning. So I thought it would be very helpful based on your experience and the steps that you took, because, so to speak, you're an outsider coming in and I'm speaking as an insider. So for them as outsiders as well, it was very helpful for them to see what can we do right now to implement these facts into our work today to help our community.
Thanks, Asma. I love that characterization as outsider insider. You have been so instrumental in building our network of experts. Your network of relationships has been really crucial, and I thank you for that.
Thank you, David.
David, I was recently invited to a event at the Islamic Center of Naperville, and I spoke about the work of art. I'm sorry, and the MENA population. And I guess the word has leaked out already because they were very excited and acknowledged that they know this work is going on. So we're definitely going in the right direction.
Wow, that's so affirming to hear. Well, so thank you. Thank you, partners, for moving this forward. And I'm excited about what is to come. I want to now move us on and invite Becky to the podium, so to speak, to talk about sustainability and grant opportunities.
Thank you, Dave. So I think I have met most of you, but my name is Becky. I'm the Population Health Coordinator at the DuPage County Health Department. And I manage our Impact DuPage program. So some of the links in the chat for the reports have been from Impact DuPage. But one thing that we kind of are always hoping for and hearing from partners that is always a need is that we want to be able to fund all of these great things that we're doing. And we want partners to feel like they are like empowered to be able to access funding both locally and at the state and federal level too, if that makes sense. So what we're looking for, I'm going to put a survey in the chat. And I hope that all of you will complete it. I would really appreciate if you did. And I will actually, so it basically just asks about if your organization is interested in any kind of training or other kind of helpful tools. It could be something similar to like what Dave shared, a fact sheet, best practices, something about applying for grants or getting funding. And then it just asks if you prefer that type of training to be virtual, in person. And then it asks about what topics, but if none of those topics are relevant or you feel like you want to write more about that, you can do that in question number 4. And then if you put your email in there for whatever we develop or whatever comes out of that, this like information gathering session, we will email you with whatever the next steps might be based on some of this feedback. So, and don't feel, if all the responses say no, like I will be okay. Don't feel bad saying no. If like somebody else has got this covered or we have this covered, that's totally fine. We just want to make sure we're doing things that are useful for all of you. So does anyone have any, we can talk about it. I think, do we have time? How much? I have till 9:30. So if anyone has any comments they would like to share about the survey or about just funding in general, we can open the space for that, right, Dave? Is that okay?
Absolutely.
Tamika, I was hoping people would just like hop on and do it right now since it's like 5 questions. If you feel like you want to send it to someone else in your organization, we can do that and then maybe say like next Wednesday. Is that good? Like end of the day? I don't know. How long do you need? It's not, I'm not going to close it. So.
And Becky, if I just could add, I think some of our thinking on the timing was that if we gathered this information within the next,
Right.
week or so, we would have some time to think about putting some things together for the beginning of the year, because typically grant, and we've seen it already with the DuPage Foundation, grants tend to come out in, early in the year. So it would be good to start some of that prep work now. And having your feedback, like Becky said, will help us narrow down some things to focus on. And we're always learning in this area too. So, this work benefits us as well.
But yeah, if you don't feel like you're maybe the best person to do this survey, feel free to copy and paste the link and you can send it to the right person at your organization too.
Becky, I'm so glad that we're looking at what's it going to take to make our work individually and together sustainable. And so now you're putting out this thought about what's it going to take for us to be able to attract grants, which we know are a crucial and important strategy. But I wonder, we have about 7 minutes in this category if we want to take this now. I wonder if we could ask all of our members to think, even thinking beyond grants, if you think about your world of bringing resources to your work, in your mind right now, what's working well and what's your biggest barrier? And I'm asking you to think about this beyond grants, about because all of us have different ways in which we're funded. But I would love to hear kind of a roundtable from folks in your own resource development world, what's working well and what's your biggest challenge?
No, go ahead, Jan, you start.
Okay, Kara, I was going to bring you in on this. I had a very eye-opening experience with a wellness project we did, and that we got a really robust turnout and participation. And Kara, this is something I think you and I had touched on earlier in that whole grant process, is the follow-up. And do we have the resources to follow up, and how do we effectively do that?
Yeah, by way of a little bit of context, and really also to give kudos to Jan. Jan and some partners went to and participated in an event at North Central College that was offering vaccination to students as well as staff, but also used that opportunity to launch a survey tool that we were requested to complete through the ARISE project. And Jan was enormously successful in getting a lot of folks to participate in a survey that's frankly pretty long and a bit cumbersome, but I think you got about 188 folks to complete that, which is just amazing, and really a testament, I think, to your perseverance and diligence. One of the reasons why we have hesitated very sincerely to ask the rest of the Heart partners to use this survey is because, I'm just going to speak very candidly to the friends in the room, we didn't really believe that the funding that was provided by ARISE, as great as it is and as helpful as it is to our coalition building, was really intended to support this kind of wide-scale survey administration. And separately, there was no funding provided, to Jan's point, to support follow-up. So if someone indicates in completing that survey that they need assistance with X, Y, Z, P, Q, and F, but there's no funding connected to the administration that actually allows you to support staff time and resources to provide that, it isn't a lack of interest, it's a lack of resources. And so I think that is implicit in the work that we need to do as a group to figure out how to fundraise to be able to provide that full range of services. But I also think it's a valuable lesson in how to be good advocates for ourselves and our group and ensure adequacy of funding for all of the components of a particular grant request, and to make sure that they're appropriately scaled. I want to be very, very clear that there's no piece of that that's intended to be a criticism of our partners at ARISE. They've been wonderful partners. I think they just have very grand and sincere objectives, and the funding, we are an unusually sized coalition. There are coalitions that are receiving this funding that are a handful of organizations or a handful of individuals, and here we are 40 plus organizations, you know, and so we receive the same dollars as other coalitions, and they are not able to go nearly so far and we really had to scale our objectives to be a good fit for what we're trying to do. Coming back to your broader point though, Jan, separate from ARISE and that survey, as a goal as a community, we do want to be able to ask people what they need and then provide them the tools and the resources that they indicate they need. That's the most important thing. The how is probably, coming back to Mila and Becky's point, it's around how to raise the funds that will allow us to actually do that work in a comprehensive and effective way. So I also think that one of the opportunities that we have is that this group is made up of all different organizations with all different strengths, capabilities, and experiences. And yes, we want all of us to get better at doing everything, but we also want to recognize who's already equipped to do one thing or another thing very, very well, and figure out how we can work together so that all of us benefit from that. It's really daunting for DuPage Health Coalition as a relatively small organization to apply for some of these very large federal or state grants. It requires a lot of bandwidth, a lot of technical resources. We're getting better at that, but oftentimes we don't feel like we're really competitive. And I imagine there are others in the room that feel the same way. I would say that the health department is one of our strengths and resources. This coalition is another one. If we come together, we can be competitive for applications that as individual organizations, we might not be competitive for. So whenever we see something that looks good, the first question is, would this help our community? The second question is, how do we marshal all of our shared strengths to be able to actually garner that resource and be able to then subsequently do the work?
And we have to be careful, since we know trust is a real issue in many of our Black and Brown communities, that we not ask people, do you need help? And then we don't follow through to make sure they're getting the help they need. And I like the fact that the day after, was it Kara, we were able to get the raw data and actually see which people or participants said they needed help, and which gave us that, it gave me the burden of how do I help these people, okay? And of course, I'm sending as many as I can to your people, Mila, but in the meantime, it worked out with the manager of the wellness center there because they needed an avenue to build trust in their community. So we decided that she and I would continue to work together, but she wanted this to be led by the college. And she wants us to come in and manage the focus groups for them so that they can look at building equity amongst their students and staff.
Very good. We have reached 9:30. And so, Jan, this is when I promised to check in with you regarding your case for health equity and whether it's best to do that today or to wait until January. All right. That was pretty clear. It took a while for that to sink in. I think I'm on board now. Well, so then what I would like to do is move us then on to, maybe this is again leverage right where you left us, Kara. As Arise, we are making a plan to work together in a sustainable way for a long time. Can you bring us on board? Where are we now?
Sure. We have a few really exciting things to report, actually. First of all, I really want to thank all of the funded partners, a number of whom are on this call. One of the pieces that we've tried to implement, DuPage Health Coalition as the fiscal agent for the grant, is a monthly reporting process. We hope it is not too painful. Our goal was to make it not too painful, but we wanted to be able to try to capture some of the work that was happening that we might not know about so that we could in turn report that back to Arise. And just a thank you to each one of your organizations for being so good about completing that report every month. It really is very helpful. There's another report due today, and I don't know how I would do it without the information you're providing. So thank you for that. It also really feels we're getting some very, very positive feedback from Arise in a couple of different ways. And I think that's a testament to the work that this group is doing and the efforts of each of your individual organizations, as well as our shared efforts. And there are a couple of consequences for that. One of them is that we offered up, and our offer has been accepted, to be the host site for the next in-person meeting of the statewide Arise project. The first meeting was held in Springfield, And we had a couple of our team members that were able to come and spend those 2 days in Springfield working with partners across the state and learning also from the subject matter experts. But of course, if you have an event that we have to drive to and stay overnight to, there's only so many people that are able to and only so many resources to support that. So we wanted to host the event here and we wanted to host the next event if possible, because we wanted to be able to have the benefit of having as many of our heart members be able to attend as possible, and also have it happen as early in our grant period as possible. And they heard the call, and we will be hosting the event on January 19th and 20th here in DuPage County at Northern Illinois University's Naperville campus. So nice and close for everybody. There will be no cost for participating. There will be food provided during the course of the day. None of us need hotel rooms, unlike some of the other folks coming from other places. We're really, really excited about that. So one of the things that you're going to see coming from us will be an invitation to let us know whether you're interested in attending, so that we can get a sense of how many folks are interested, and we can begin the process of lobbying and advocating at Arise to ensure that as many of us who are interested in attending can attend. I can't promise that they'll be able to accommodate 100% of us, but I think that they will do their very best to accommodate that request, since all it's really is about making sure we have enough space in the room and lunch. You know, we're not asking them to pay for hotels or a whole lot of other additional costs. So anyway, look for a poll to come from us or a survey to come from us that indicates your interest and also indicates how many folks you think would be interested from your organizations. And then we'll take that information back to Arise. I will also share that a number of us met in person. Was that last week or the week before last? Days run together, but it was recently to complete something or begin the process of completing something called a driver diagram. This was new learning for many of us, but I really want to thank everybody for taking that walk and living in the murky space of figuring out how to do it. Becky has taken that information back, and we'll be working together on putting together a draft version. A driver diagram is really sort of a backwards looking view of what the primary drivers are for either a challenge or a benefit that we want to see. So sort of like the root cause, what things we think we could do as a community that would most impact a challenge that we're facing. And you could do a million different driver diagrams around health equity. You could be very broad or you could be very specific. But that was the work that we did a few weeks ago, and we'll keep folks updated on its progress. It's as much as anything a learning exercise on how driver diagrams work, not exclusively with the goal of focusing on this particular driver diagram. The last piece I shared, the best for last, I think, is that because we were able to take these resources and launch our efforts quite quickly, because we were already established as a coalition, and some of the other funded partners are earlier in their origin story and had more work to do to build up what their coalition was or could look like. We've been given notice from Arise of two things. This project was due to end in May, but they've let us know that they're going to extend the project until December, and also that they are going to provide us another $100,000 in funding to support the extension of that project from May until December. So one of the things that we'll be looking at as a coalition is to figure out how best to use those additional resources to support our shared work. No decisions have been made about that. We'll certainly listen to everyone's feedback and think about how we can be most beneficial with those additional resources. But it's fantastic that a project that we didn't really think we were going to get, that ultimately we were thrilled to get with $135,000 of funding to attach to it, has now become a $235,000 funding award that will allow us to continue to do this work together with a little additional resource to support it. So stay tuned, but I think that's probably the beginning, middle, and end of my updates.
Do you mind, Kara, if I share? Here's a little visual reminder of the driver diagram session, and thank you to all those folks who came together.
It was great to see everybody in person.
And if I could tag on, I really hope that folks will be able to come out in January, because that's also, you know, related to Derek's presentation. This is a time for us to build relationships with our allies all across the state. And driving policy or influencing policy at the state level is so important to our work. So this is a time for us to build some relationships and strength there.
It's also my sense, and Becky could say more about this. I think you're only the only one of the three folks that were in attendance in Springfield. But my sense from looking at that room and understanding what happened there was that there was a lot of opportunity to do small group work. So yes, there's some content and some subject matter expertise that's coming to you by way of education, but a lot of the time that was spent in Springfield was spent actually working together on using those tools. And that would be a great opportunity for us, as many of us as are able to be participating.
Yeah,
Kara?
there was, oh, go ahead. Someone else I think was going to talk. Oh, Saima, go ahead.
I was just asking that who went to Springfield?
So I went, and then Joelle from DuPage Health Coalition and Beth Carey from DuPage Federation. We originally thought we could only send 3 people. And then, so anyway, it seems like they've developed a system where more of us could go this time. So hopefully people outside of DuPage Federation, DuPage Health Department, and DuPage Health Coalition can go.
It also came up so quickly. We received that grant funding, and then it was only a matter of weeks before the first event. So I know it was harder for some of the other partners to be able to make their schedules work to be gone for 2 days at that period of time. Actually, I'm really glad you said that, Becky, because it reminds me of 2 other things. One, it all related to these, they call them CHILAs, and I can't remember what the acronym of CHILA stands for. So just no, I don't.
I think it's
yeah,
Community Health Improvement Leadership Academy.
Great. So they said I hear anecdotally that when we got there, they did have some plenary sessions that people could sign on for. And I know a number of folks on this call joined for an hour here or there to participate in the plenary sessions. I think that opportunity will exist at future CHILAs as well, which is great. But they also gave us 2 additional pieces of information. One, because they're extending the grant term until December of 2023, they will add 1 additional CHILA. So they originally planned on having 3, and they're now going to have 4. The first one in Springfield, the second one in DuPage. They haven't announced where the 3rd and 4th are going to be. So there will be 2 more opportunities for us to have representatives participating in events that may involve some travel. Although it wouldn't be crazy that they might be held in Lake County or Will County. They may still be local to the area, but just not quite as close as DuPage. The other thing that they shared with us was that they were going to give us some additional funding to support travel expenses related to these CHILAs. So that would mean that we would have additional resources it's not really relevant to us in January since we're local, but as we look forward to the event that I believe is being held in May, and then my guess is probably the next event would be held in September, we'll be able to look at the resources that we have left for travel and give people a sense of just how many people we could fund to support. And I'm pretty sure it's going to be more than 3. I think we'll have the ability to have 5 or 6 or 7 people potentially come to these events, and would love to have different people be able to participate in different events. So we'll definitely let you know as we find out more. You don't have to be a funded agency of ARISE to be a partner in these projects, because really this is all about building heart into the coalition we want it to be. ARISE is just the the gas in the automobile as we've been using as an analogy.
Kara, thank you. And as you've just talked about, an additional $100,000 and the opportunity to host this group and bring some attention to the work we're doing. I gotta say thank you to the DuPage Health Coalition for your leadership in administering this. It's as it is a relatively small grant for all the agencies, that also relates to what you receive in support for administering it, and you're putting way more in than the grant provides, and I'm so appreciative of that. The benefits here are enormous.
It's our pleasure. It's our pleasure. It's really exciting to be a part of the work. It's definitely not about the money.
We're getting ready to move into the part of our meeting for member updates and events. And what I'd like to do here is, we have a really good sized group today, and the nature of our conversation has brought about half of us into some conversation, but about half of us have not really been. So I want to encourage everyone, if you're able at this point, to the extent you're able, please turn your camera on as we do these updates and events. And we've come up with some asks of each other through this meeting today. We're asking folks to respond to a survey about collaborative training and other opportunities for grant development. We're asking folks to provide an initial RSVP regarding availability on January 19th and 20. So I want to invite all of you, as you give an update or share information about what's going on in your organization or community, make an ask of us. Let us know what it is that you need, or let us know what's going well that you want to share with the rest of the group. And so I just invite folks in a popcorn style, come right on in and share.
David, I have to share something, but if someone else wanna go ahead first.
I'd say go ahead, Saima.
First of all, thank you for this opportunity. I want to share one story, and then I will bring this ask. And this is a common story for us. But last week, our team was listening to this situation, and all of us were almost crying. And so because of HIPAA rules and regulation, I will not share any location or any gender or anything. So this is a refugee family. Father came to case manager, and he shared the story of, he was crying, and it's a recent refugee. And you all know that refugees are not here because of their will. They didn't want to leave their homes. They had to be brought up because there are wars and many big, huge issues in the area. Their homes are destroyed. There's nothing over there. They basically saved their lives to come to US. So basically, he speaks different language. His whole family speaks different language. He has multiple children, all young children. His oldest child is a teenager. That child went to school where bunch of kids, locked the child in the bathroom and beat the kid up and threatened him that if you say anything, you will, there was a death threat, according to the dad. We don't know the intensity in actuality, but something big happened. The child was scared, came home, didn't eat anything, and he didn't want to talk to anybody, except after a few days, the child spoke to one person, and that person came to the family and told them what happened. Father went to school denied everything. They said that there's nothing in camera, and if it is any situation, we would have taken care of that. He went to police. There was no report filed. I don't know the reason. The child itself starts showing symptoms. mental health symptoms and eventually was taken to the mental health facility where the person was admitted. And then they found that this teenager tried to kill himself or herself multiple times because there was marks on the wrist. So now this teenager is on the medication, might be lifelong medication. The father and the mom are unable to do job because of previous surgeries and injuries. I'm trying to not share a lot of information, but we all were extremely upset. And then we found out that there are many other refugee families who claim that there's bullying happening. And we know bullying happen all the time. It happened all the time. And many of our children might been through this. But the situation here is the language is a barrier. They don't know anything, how system works. They have no idea if there is any support for bullying available. So what can you do? What can our organizations who are sitting here do in DuPage County to prevent anything of this nature happen? Like one ask is I want everybody to be very, very empathetic to these people who are coming from other countries and who are brought here because of us sometimes, because the United States was invading the country or whatever political situations are. So when we are bringing these families in, and then we are not providing enough support because we are not government agencies. We cannot provide all the support which these families need. Even for resettlement agencies, ton of funding is cut down this year and last year too. So they are also limited in providing services. But as a community, what we can do. And second ask is if you can reach out to your nearby school, if you are in touch, your organizations are in touch, how can we work together because I've been thinking about it, that if we empower these students and these families and educate them and empower them that these are the signs of bullying, bullies, and how to prevent, that might be helpful, because these kids and these families have no idea. They have no idea. They're completely blindsided.
Being the president of the Bilingual Parents Committee here in West Chicago, many of these things I've been involved with, trying to get the attention our kids need when they're going through bullying and all this. I do wish that the parents in those schools would make a committee themselves, create a committee, and I could probably step in and help, because it is going to need all the parents and students together to speak to the administration of that school. That is unacceptable. They have to have social workers, counselors, regardless if they're refugees or anything. These are students coming to school, and the schools are getting funding. Public education is getting funding to attend these needs. And I'm more than willing to try to create this committee and come together if need be. I'll be the mediator there. It's unacceptable. That is unacceptable. Just saying that we're looking at the children having to need drugs now, and it shouldn't get to that point. It shouldn't get to that point. There is assistance for the children, and it has to be security for the students. So we can collaborate. We can reach out together and create this committee and begin.
I would love to hear thank you so much. I would love to hear from others, your feedback, response, And we can definitely, I know for sure that everybody will join hands. There's no question. But what is your feedback? And it was troubling me, and I was thinking that this is a perfect time to share it with Heart.
A thought, Saima, and just sort of thinking long-term about solutions and resources. Many on this call are probably aware that during this most recent election, there were 3 new 708 community mental health boards that were voted in, approved. One in Naperville Township, I should say, it's not just Naperville, one in Lyle Township and one in Addison Township. Those joined 2 that were already in existence, one in Bloomingdale Township and one in Milton Township. And it occurs to me that a project intended to support students experiencing violence or threats of violence, either on a countywide basis or in an individual community, would be an excellent application to a 708 or more than one 708. And because we increasingly have 708s in many communities, you could potentially provide funding for an area that was larger with that resource. So it's just something to think about. And unfortunately, for those 708s that were just voted in, they're probably a year to 15 months from being able to actually provide funds to an organization. But it's something to think about. I think that Bloomingdale has about $800,000 a year to provide. Milton has about $700,000, and the other 3 still to be determined. It depends on how the township board decides to support the levy, how much funding they want to raise. But regardless, if you put those pieces together, or if you're working in a particular community that has a 708, I would really encourage you to use that as a potential resource.
Mhm.
Sama, I'm going to put you in touch with some wonderful people over at Northeastern DuPage Family and Youth Services. They are in partnership with our health department and NAMI, and they also go into the schools. So I will, on the email that I'm going to send you, on something else, trying to remember right now, I will introduce you to Dana Pavlo, and she can possibly sit down and work up some kind of strategy to help you deal with this.
Thank you. Thank you so much.
I will jump in to Rafa asked me to announce a couple of things. We're doing peace circles every Monday at the Casa DuPage. Every 2 weeks we're calling a peace circle. We get together. It's a peaceful circle led by our instructor and psychologist Teresa Dupne, and we get together this coming Monday. It starts at 6, from 6 to 7. Every Monday there's a peace circle, but precisely this coming Monday will be for women. We talk about depression, mental health. We talk about issues, and everything we talk about at this peace circle stays at our peace circle. So, and then we have others, not just for women. We have others that every Monday we're holding this peace circle from 6 to 7 every Monday. And it's an opportunity that we're trying to give our community because precisely we're going through a lot of stress. There's lots of depression, and maybe this is an opportunity to maybe bring our kids. I'm hoping my colleagues will create one just for teens, because I do see a tremendous need with my own. I have 2 teens to have an opportunity to be among themselves with a professional, but in a protected circle, in a protected way where what they're sharing, what they're saying, you know, won't go out of our building. It stays there and they're safe. So.
I wanted to, Julietta, thank you for sharing that. It turns out that's a core support also for what Sima has brought up. Where's the availability for young people to come together in a safe space and talk about what's happening? And I wanted to maybe engage Tamika for a second. Tamika, you mentioned that you have engaged an administrator in Naperville. My own story is I watched that Naperville has brought on a school administrator who had been an administrator in my home, which is Oak Park, Illinois, in the high schools here. And she had left our community at the time that we were having some conflict in the high school. She came back to do a workshop on racism and fighting racism in schools. So it's a little different topic, but Sima, I'm going to get around to where I think it fits. She gave a stunning presentation at our library about engaging school culture. And there's so much to it, but one element of it is bringing everyone's focus onto the voices of students and their experiences. And in this case, I'm thinking that's the young person, Sima, who's being affected here. We so much need that voice to be heard and respond to that. Parent so much needs to be heard. So I wondered, I'm not remembering her name now, but I wondered, Tamika, if you had reached an administrator, if it's a new administrator, and if it might be that person. But in any case, I'd love to engage her and her thinking about this in relationship to new arrivals, not speaking English well, being bullied, and having to deal with all that comes with that. How does that fit into her framework, and what could we learn?
Thank you, David. Our thing is that we don't deal with bullying at all. It will be another task and area to look. But because it is a hurdle in self-sufficiency for a family, it's hard for them to move on. So it comes indirectly in our range, but I would love any other organization, any partners. If DuPage County Health Department, DuPage County itself, anybody can take a lead on this and help us in this regard. We will provide any resources from our side, sharing the information in terms of which nationalities, what language, anything we can do, we'll do that. But if nobody else is there, of course, we'll do it with heart together.
Sama, I think, Kara, is Dana the clinical director at NESRA?
Sorry about that, muting. I work more closely with Shannon Hartnett, who's the executive director of NEDFIS. She's actually my fellow colleague at the Milton 708, actually. But I'm familiar with the name Dana, but I don't know her role.
Dana is the clinical director, and Sama, she goes into the schools, and they have funding. They could use more funding, of course, but I think once I don't know what area you in, but I do know that not only are they covering northeastern DuPage County, but they have also recently contracted with District 204 in Naperville to deal exactly with this problem. So I'm going to send you an email and introduce you to Dana. And she's very responsive. So I'm pretty sure she can align you with someone to come into the school if she doesn't do it herself.
That'd be great. Thank you. Thank you, Jen. That'd be great help.
Hi, Sama. This is Tamika. I put the information in the chat It's a quick link to the profile for the new assistant superintendent for the school district in Naperville, 203. And she's actually from, I believe, the Oak Park School District, David. So maybe you know her, but she said that you mentioned that she came from that school district and now she's here in Naperville. And so I did send a link to her profile, and hopefully she can connect and help with what you're trying to do, Salma.
Thanks, Tamika. Dr. Holland, that's indeed the presenter. She had already left our district to go to another by the time she did this presentation a few years ago, but she's just thought this stuff through and lived it through with students in her personal relationships and at systems level. She's just a gem of a resource.
Yes, we actually had her speak at one of our NAACP education committee meetings on diversity and belonging for the students for Naperville 203. So she's a great resource.
Thank you.
And I want to note, Derek put on his policy cap and said, what's the policy for requiring interpretation and translation in support?
Being in these committees, I just put it in the chat. There is funding all schools receive to attend the needs of the students, regardless of their background. There is funding, bilingual BPAC, that's where I'm in, but it's not just about Latinos. It's about parents who have children who, they speak a different language other than English, or they speak it as well, both languages. And a disadvantage is maybe the parents cannot communicate. So there is funding that the state of Illinois, I don't know if it's federally, but the state of Illinois puts into each public school to attend the needs of the students. That means they need to have a counselor, they need to have a social worker. There needs to be a student liaison to speak for the parents, to the teachers, etc., etc. I am reaching out. I do want to do this. It's unfair, and it's always the reason I got into this here in West Chicago, because things need to be fixed, and we're working on that. And it will take parents in this community to go to the schools and tell them our kids need the attention, and you have funding. So we need our students to be attended.
It's a long road. It's a long road for these families. I always thought about housing, food, shelter, depression, anxiety, but this was, we knew that bullying is going on, but at that level, that was news to us. And I'm glad that we have this meeting and I'm sharing it with all of you. And let's join hand and do something. Thank you for all the support.
And I will push my colleagues to do one for the kids. They gotta, because I have two, and they're struggling as well with some things. So I have brought it up, and Ralph was saying yes. So I'm gonna insist this weekend, so we at least have one in the next week or so, and I'll let everyone know so that you can bring your kids. Yeah. Mm-hmm. It is astonishing how just COVID, all that isolation and everything, kind kind of traumatized her kids. You know, being locked up, and there's a case where I'm trying to help this mom because the child doesn't even want to go to school anymore. And it's sad because the isolation made a developmental delay. She was fine, but the isolation created this developmental delay. And now it's hard for her to be learning things she needs to learn. So there's many drawbacks on COVID, not just us. Our kids are feeling the long COVID effects for the kids is that the stress, the disability, the anxiety, that it all built because they were all having to be locked up. So
Thank you, Juliet. Are there other asks or resources to share? All right. Then I think I'm going to bring us to a close. We're at 10:10, so we'll stop about 20 minutes early. Thank you all for your participation here. Thanks. This last conversation that we've had around a need and a support is so important. And I so appreciate the relationships that we've built here that make this possible, and appreciate the courage to bring forward the issues and the willingness to share resources and ideas. I want to remind folks that Becky has left us a survey to help us do some work on grant development together. And Kara has asked us to let her know whether we will be able to attend January 19th and 20th for an Arise Chilla gathering where DuPage will host. And then, of course, we have this fantastic set of activities that we've just identified in the last few minutes. Thank you all for your contributions. Thanks for being here. Best health to you over the weekend, and we will see you soon. And we're adjourned.
all right.
Thank
Have a
you
good
all.
weekend.
Happy holidays, everyone.
Happy holidays.
Yeah.